If you're like most of the patients we treat at the ATL Pain Institute, you might be watching this video with a healthy dose of skepticism. You've probably seen countless doctors about your peripheral neuropathy pain, perhaps tried various prescription drugs, but despite everything you've tried, your pain still exists. Maybe worst of all, you've been told by one or more doctors that you'll just have to live with it, or that your pain's all in your head. At the ATL Pain Institute, we know peripheral neuropathy pain is real. We see it every day in the countless number of patients we treat. Many of those patients, some whose stories you'll hear in just a moment, will sound very much like your own. They too were skeptical, were frustrated, and thought maybe nothing could be done about their pain. However, what they discovered is that there is hope, and you can get your life back. But we know we have some convincing to do before you take our word for it. So let's begin with an actual patient story, one of several we'll share during this presentation. What you're about to view are the raw comments taken just after a patient treatment session in our office. Real stories from real people with real results.
Hello, I'm here with Josephine and her daughter Jennifer. Thanks guys for coming in. About 11 weeks ago, Josephine came in and she walked in with a walker. She could barely walk around the office. Her feet were so bad, she had very bad neuropathy. We did our exam. She scored very low, and her daughter and herself made the decision to work with us and go through our neuropathy program. You're on what, number 11 or 12 visit today?
12.
12 visits.
Yes.
And you haven't driven in 2 years.
That's correct.
You've been in the walker. And you're now able to walk the length of our office back and forth.
Without holding on.
Today you came in without your walker. What did you have in your hand?
A cane.
Show that beautiful cane.
There you go.
Normally I'm not really happy to see the cane, but we're 2 days she's been walking.
Walking with a cane.
And our goal is that you're going to be driving by the end of April.
Yes.
We're excited. Tell me a little different. What do you notice? Can you stand and cook again? Tell me some of the things you can do.
No, I can stand, fix my bed without having to sit down.
Breakfast.
My breakfast. I don't need the walker to go walk around and bring it to the kitchen, to the table.
restroom.
I go to the restroom without the walker.
She's able to go up and down the stairs more than once a day.
Yeah.
Beautiful.
It's awesome.
My energy level is up,
Okay.
and my feet are feeling perfect, almost perfect.
You know, the wild thing was right before you did your first treatment, I remember the color of your feet were almost purple, especially the left
Yes,
one.
the legs.
And we knew after one session how nice. They both came back. They looked pink. It was great.
Normal.
So we're excited about your progress. We're halfway there. Now we're working on your balance.
Yes.
We're in the second set. We're working on strengthening your legs, which you're doing great. So I want to commend you for sticking through it, not missing an appointment.
I thank you, doctor.
Oh.
It's lifted
doing it
her
for me.
self-esteem
My
as well,
self-esteem, yeah.
because she was told that she'd never be able to walk again, and here she is with a cane.
They told her to get ready for the wheelchair, right?
Yes,
Yes.
get ready for the wheelchair.
And-
Here we are with a cane.
And
And
hopefully
it's
it will give you your independence back.
Yes, that's what I
and
need.
mine too.
All right, well, great. We can't wait. We'll do another one at 20.
This is just one of hundreds of stories we could share. But let's back up for a moment and take a quick look at why and how your body is going through what it is with peripheral neuropathy.
Basically, the body's nervous system is made up of two parts: the central nervous system, which includes the brain and the spinal cord, and the peripheral nervous system, which are the connecting nerves running from the brain and spinal cord to the rest of the body, including your hands and feet. If you think of healthy nerve endings like this dandelion, the nerve endings pictured here at the end of the stalk are pretty full and complete, much like your nerve endings were before your symptoms began. However, as your condition gets worse, nerve endings can deteriorate, causing a host of annoying, painful, and sometimes debilitating symptoms. And if you're like many neuropathy patients, when your doctor initially diagnosed your condition, they may have told you that your nerve endings were dead or too far gone for treatment. However, we find that more often than not, that's just not the case. But more about that in a moment.
Hi, I'm with Jim, and Jim is halfway through our program. Jim, explain to me a little bit how you've been feeling. What are you doing? What are the differences?
Well, I've gotten a lot more sensation back in my feet. Yesterday was a terrific day. Felt like my feet were almost completely normal, and
Great.
It's my wife is even more amazed than I am, really.
Really?
So it's pretty exciting, and I'm looking forward to getting to the 20th session, see what it's going to be like then.
And you're doing your home therapies, you're disciplined, you're staying on track, right?
Yes, sir.
Awesome.
Yeah, it's,
All right.
It's worked out well.
Good. We'll look forward to documenting your progress.
Okay. Thanks.
As far as the causes of peripheral neuropathy, those can vary. However, research suggests that as many as 2/3 of all cases are due to diabetic complications. However, the condition can also be caused by the use of statin or cholesterol-lowering medications, and it's a common side effect for people undergoing chemotherapy or radiation therapy. Furthermore, peripheral neuropathy can result from exposure to industrial or military-grade toxins, as well as from spinal-related conditions like spinal stenosis, herniated discs, and sciatica. And oftentimes, the condition is misdiagnosed as plantar fasciitis, Morton's neuroma, or restless leg syndrome. So, what are the warning signs of peripheral neuropathy? They can include a numbness or burning pain in your hands and feet. Sometimes this can take the form of tingling or prickling pins and needles feeling. Additionally, the condition can also cause cramping and restless legs, as well as numb toes, difficulty walking, or balance problems, even difficulty sleeping. If you're like most of our patients, you probably have multiple symptoms from this list. That's the bad news. However, the good news is that you've turned to one of the nation's premier facilities for treating peripheral neuropathy, the ATL Pain Institute.
Widely featured in print media on topics related to peripheral neuropathy and other conditions, the ATL Pain Institute doctors have additionally been profiled on TV shows like Atlanta and Company, as well as appearances on the nationally seen program Health Matters Today. All doctors at the ATL Pain Institute are certified neuropathy professionals with a doctorate in chiropractic. Additionally, we are members of the Neuropathy Treatment Centers of America, or NeuroTCA, a nationwide network comprised of over 150 clinics throughout the U.S. and Canada. In a recent national survey, over 90% of patients treated utilizing NeuroTCA protocols indicated they were satisfied with treatment in as little as 2 weeks. Locally, we've successfully treated thousands of patients for peripheral neuropathy as well as a host of other conditions without surgery, non-invasively, completely drug-free. At their core, the doctors of the ATL Pain Institute are truly passionate about getting you better, even when other medical professionals may have given up.
You know, oftentimes patients have had this condition for quite a few years, and they've been to their internist, they've been to neurologists, endocrinologists, and many times the doctors are like, "Yeah, there's nothing we can do for you." And the standard of care has really been to prescribe anti-seizure type medication, which is great to block the pain, but it's really not correcting their nerve issues. So when they get to our office, you know, they want to know what's going on. They're like, "What's different about this?" And it's really, you know, the lasers and the infrared diodes that are in these laser boots. And they range from 660 to 920 nanometers. Now I tell you that because the frequency goes into different depths of the epidermis and subcutaneous tissue. It allows the body and the blood vessels to open up. It decreases pain and increases blood supply by over 400%.
Additionally, a recent NeuroTCA study was conducted to monitor neuropathy patients' pain ratings before and after initial treatment sessions. After just 4 weeks of treatment, the average pain rating described by patients went from an average level of 8.1 down to a level of 2.9, a decrease in pain of over 64% in just 4 weeks, utilizing the same treatments found at the ATL Pain Institute. Likewise, further studies are revealing dramatically increased nerve regeneration in patients utilizing these same treatment protocols.
That's a little about us, our staff, and the science behind our treatment methodology. However, we know you might still be skeptical. Given what most peripheral neuropathy sufferers have experienced up to this point, We accept that. And so with that in mind, we hope as you watch a few final patient stories, you too will begin to feel that there is still hope to overcome your frustration and break the grip of peripheral neuropathy and finally get your life back.
I'm here with a wonderful young lady who's driven 169 miles, right?
That's correct.
And she comes visits her daughter, and she's been coming doing our program. Miss O, tell us what you've noticed different in 30 seconds.
I can walk.
Mm-hmm.
I have no visible pain. I have pain occasionally, but I've had treatment by neurosurgeons, neurologists, orthopedists, and the very same story. There's nothing we can do. Even though I've had 3 back surgeries, I still don't have that much relief in my feet and legs.
Mm-hmm.
But just in the month that I've been using the equipment.
You're home. You brought the home unit, and you had it at home.
I've been using it daily, been very faithful. And apparently my tests are better, and I feel better, and I walk better.
You've had 40% and 50% improvement on both your legs. You're in a mild range, almost normal, and you're just 30 days into this, so that's great. We're happy, and you're so disciplined with it. What would you tell other patients who have tried and gone to other people and they're at their wits' end? What would you say to them?
Don't let anybody look at you in the eyes and say, there's nothing we can do. Maybe
Good.
there is nothing they can do,
Mm-hmm.
but there's something that can be done.
Okay, awesome. Thank you so much. I'm with Miss Jeannie. Show her what's going on with your hand. Put your hand up there and show us. Go ahead, squeeze it. Look at that. Tell us, why is that important?
Well, for 2 years I haven't been able to make a fist with this hand,
Uh-huh.
and now I can.
You've been doing our neuropathy program, correct?
Yes,
You're doing great. Your daughter brings you in every other day. We're so happy for you. And this is just your 2nd week, so...
third, I think.
3rd week. So you're doing great. Keep up the good work. I'm with Miss Ann. She just graduated from our program, and I'm happy to say she's done very well. Ann, please just tell us a little bit in your own words about what you've noticed.
Before I started, I couldn't feel my feet, which is a frightening feeling. I now feel much more confident. I feel like I can drive better, if nothing else. I still have a little bit of pain, but it's very easily managed, and I think I will do very, very well. I will continue with my maintenance program and my at-home things, and it's a great thing to do for yourself.
Thank you. I'm with Miss Janice, and we're going over her results. She had 50% improvement. She's near normal with her sensitivity in her feet. Janice, tell us a little bit what you've been experiencing halfway through the program.
Well, I've been very pleased with the program because I can now stay on my feet for hours at the time. I don't have as much tingling. Don't have any of the sharp jabbing pains in my feet anymore. So I can definitely tell a big change.
Less burning?
Less burning, a lot less burning.
Okay, thank you.
So now what? Maybe you still have a few questions like, should you wait? Could your condition get better on its own? Is your condition even treatable? Well, just know that after treating thousands of cases, the consensus is that peripheral neuropathy rarely, if ever, improves on its own. More often than not, your condition will continue to get worse. In reality, there's only one way to find out if you can be treated. Give us a call today and reserve one of our new patient consultations. During that appointment, we'll conduct comprehensive neurological testing to see if you are a candidate for treatment. The sooner you make the call, the sooner we can help you resume your life.
I'm with Elton and Catherine, and Elton's been a patient for a couple months, right, El?
That's correct.
And just in your own words, kind of explain what type of symptoms you were having previously.
Basically, I was not able to sleep at night, and when I did go to sleep, they would wake me up. I'd get this burning sensation in my feet that woke me up, and I was not able to go back to sleep after that happened.
Mm-hmm.
Other than that, I had just general problems with my feet.
Balance, gait, those type of things?
That's right, and they all were...
When you first walked in, I remember you would take these small little steps because it almost, you said to me, it almost felt like you had shards of glass or something in there that was very painful.
Correct.
It looked painful when you walked, You're halfway through our program. Tell me where you're at now.
Well, at this point, I have not had any burning at all. I've been able to sleep through the night.
It's been the last 3 weeks, right?
That's correct. And I'm walking straight.
Good.
And other than that, I'm not feeling any pain, so
Are you sleeping better? That's my big thing.
totally sleeping better.